Today I want to talk about one of the most underrated procedures in plastic surgery, blepharoplasty or eyelid surgery, and why it can be one of the most subtle, natural-looking ways to make someone look years younger. I'll start with something I hear almost every week. Patients come in and say, I'm sleeping more, I'm exercising, I'm using great skincare, I even get Botox, but I still look tired. I don't feel tired, but my face looks tired, and very often the reason is the eye area. The eyes are the focal point of the face. People look at your eyes when you speak. They look at your eyes in photos, and the eye area tends to show aging earlier than other parts of the face because the skin there is thin and constantly moving. So even small changes can create a big difference in how you're perceived. Let's talk about what actually happens as we age, because understanding that makes the procedure make sense. On the upper eyelids, the most common change is excess skin. Over time, the eyelid skin stretches. In some patients, it starts to drape over the natural eyelid crease. This can create what people call hooded eyes. It can make the eyes look smaller. It can make makeup smear. It can make you look heavy or sleepy. And for some patients, it can even interfere with peripheral vision. On the lower eyelids, the most common concern is puffiness or under the eye bags. And I want to be clear, this is not always caused by lack of sleep. Many people can sleep 8 hours and still wake up with bags. That's often because with aging, the support structures around the eye change and their natural fat pads can shift forward. The skin also becomes thinner and looser, and the combination creates puffiness, shadows, and a tired appearance. So what does blepharoplasty do? In the simplest terms, eyelid surgery is designed to remove or reposition the tissue that is creating an aged or tired look while preserving your natural eye shape. And that last part is the most important thing. When people hear eyelid surgery, they sometimes worry, will I look different? Or will my eyes change? Or will I have that pulled look? And well-performed blepharoplasty is not about changing your eyes. It's about bringing your eyes back to the way they looked before the aging changes showed up. Now, eyelid surgery generally falls into two categories, upper blepharoplasty and lower blepharoplasty, and sometimes patients benefit from both. Let's start with the upper blepharoplasty. Upper eyelid surgery addresses excess skin and in some cases a small amount of fat that contributes to the heaviness. The incision is made in the natural eyelid crease, which is why it typically heals very discreetly. The goal is to create a clean look, natural eyelid contour so the eyes look more open and refreshed but still like you. A key point here is that we're not trying to create a new eyelid shape or make the eyelid look overly done. We're restoring the contour that has been blurred by excess skin. When it's done correctly, the result is subtle but powerful. People often say they look more awake, more rested, even happier because the eyes look brighter. Now let's talk about lower blepharoplasty because this is where technique and judgment matter a lot. Lower eyelid aging can show up as under eye bags, puffiness, and sometimes loose skin or wrinkles under the eye. The surgical plan depends heavily on your anatomy. Some patients primarily have prominent fat pads that create bulges. Some have a combination of bulges and skin laxity or excess skin. And some patients don't have a lot of puffiness, but they have hollowing and shadowing, which is a different issue altogether. One of the biggest misconceptions is that lower blepharoplasty is simply removing fat. In modern lower eyelid surgery, we often are very conservative about removal because removing too much can lead to a hollow look, and that can actually make someone look older. In many cases, the goal is to smooth the transition from the lower eyelid into the cheek so the under eye looks rested and natural. So how do you know if you're a candidate or a good candidate? If you notice heavy or hooded upper lids, if your eyes look smaller than they used to, or if you feel like you always look tired in photos, you may be a great candidate for upper blepharoplasty. If you notice persistent under eye bags that don't improve with rest, or you feel like your under eyes make you look exhausted or stressed, you may be a candidate for lower blepharoplasty. And if you have both, doing both can create the most balanced, natural-looking rejuvenation. Let's talk about recovery because that's a very practical concern. After eyelid surgery, swelling and bruising are normal. The first several days are usually the most noticeable. Many patients feel comfortable being seen publicly somewhere around 1 to 2 weeks, depending on how they heal and whether they use makeup. But the refinement continues over several weeks as the swelling settles and the final result becomes smoother and more natural over time. One thing I always tell patients is that eyelid surgery is often one of the best return on investment procedures because it can be so meaningful without being obvious. The best outcomes are when people say, "You look great," or "You look rested," and they can't pinpoint exactly what changed. So if you've been thinking about eyelid surgery, here's the takeaway. Blepharoplasty isn't about changing your eyes. It's about removing the heaviness and tired signals that aging creates and restoring a refreshed, natural look. If you're curious whether you're a candidate, the best first step is a consultation. We'll evaluate your eyelids, talk you through your goals, and recommend the safest approach to get you a subtle, natural result. So call us at 518-583-4019 or go to www.saratogasspringsplasticsurgery.com.